All right, good afternoon, everyone, and thank you for joining today's webinar. My name is Adam, Content Marketing Specialist with Schein, and I'll be your moderator. If you have questions, please type them into the Q&A section of your control panel, and we will cover as many as we can at the end of the webinar. This webinar is presented by Henry Schein Dental Business Institute, and no CE credits are being offered for viewing this presentation. Joining us today is Scott Hironaka, Vice President of Unitas Dental. Unitas Dental is one of the largest PPO management companies in the U.S., actively representing hundreds of dental practice clients in over 44 states. Scott, looking forward to your presentation. Take it away.
Thanks, Adam. I'd like to welcome everybody to our session tonight. Our goal with this PPO planning session is to give you some really good strategies to improve your practice profitability and hopefully reduce a lot of the frustration that many of you may feel in participating in network. And I'd like to start by really focusing on some of the sources of that frustration, which I believe really kind of center around the lack of control that many of you may feel with your pricing and with the fees that you're able to charge for the services you provide. I think it'd be helpful when we talk about coming up with strategies to deal with participation to really understand what the value proposition that PPO participation is really offering. First, to your patients, I think the value proposition is probably pretty obvious, but might have a portion of it that you haven't thought of initially, which is the straightforward value of patients participating and enrolling in plans is obviously to reduce the cost of their dental treatment. But it's sort of bigger than that in that for many patients, the financial commitment that they're going to make to receiving their dental treatment is somewhat intimidating. And so to involve a third party that will help them feel like the pricing is validated, and not just that it's fair, but that perhaps it's even advantageous pricing to them, is going to help them feel comfortable to accept treatment. And really, that's the value proposition that your participation in the network is offering. It's not necessarily to increase the number of patients or provide additional patient acquisition, but rather help patients accept treatment. And so it's important to realize the reason why you're participating in these networks is to increase treatment acceptance, not necessarily increase the number of patients that you have. That might be something that is an additional benefit, but I think if we look at the trends for enrollment, we can see that the trend has certainly been on an upward trajectory over the years. But if we look at the raw numbers at over 250 million patients that will have some sort of dental benefit, really these plans providing new or additional patients, they somewhat have their limitations. But again, it's important to realize that the primary reason for participating is to help your patients accept treatment and feel comfortable accepting treatment. And we point this out so that we can really understand the best ways for you to come up with strategies to work effectively within these networks. What we've diagrammed here is really the value proposition that's being offered through participation. And if we think of that area, the value proposition being that area where the fees that are being charged for the procedures are at a level where the patient is going to feel comfortable making that decision or accepting treatment, there's actually a very wide range. And so we can see in this diagram kind of shows the typical practice and how they are engaging with the network. And we're at the top line, we have the market rate for dental procedures. At the bottom of the range is going to be your actual cost to provide that procedure. And somewhere in between those is going to be what is going to be offered to the enrollees of the plans that you're in network with, that's going to trigger their comfortability at accepting treatment. And you can see in this kind of range, we have all the different plans that a practice might be participating in across the bottom. And in some of those plans, the compensation rates are below the cost of the procedure, or certainly very close to the cost of procedure. And at the bottom range of that value proposition. Meanwhile, the green line kind of shows maybe if you have an in-house plan, that your in-house plan is not offering a large enough discount for the patients to be comfortable paying for that plan or accepting treatment under that plan. So if we want to look at what the ideal situation is, and again, before we talk about strategies of how to get into that range, we probably need to understand what we're trying to accomplish. We believe that treatment acceptance is really a more narrow band, and that there's an opportunity for practices to negotiate and to arrange a better compensation contract with the network that's going to still allow for that value proposition, still provide the benefits of participating, but not sacrificing profitability of the practice, or in some cases even having to subsidize certain groups of patients with other patients. And that's really the way to think about it when you're enrolled in a plan or under contract in a plan where your compensation is below the cost of the procedure, your ability to provide that procedure. What you're really doing inadvertently is having certain groups of your patients subsidize other groups of patients. And you don't really want to do that. We want to treat all of our patients fairly, and that's sometimes a great thing to point out to patients if you are unable to participate in their plans. Sometimes patients will ask, why aren't you accepting my insurance? It may be because, unfortunately, the network is not offering suitable compensation that's going to even cover the cost of the procedure. And if that's the case, then you can explain to your patients that, you want to treat all patients fairly and not have certain patients subsidizing other patients. You'll notice that I've right there as a red line, we've designated what we call target fees. And this is really kind of the first strategy I want to present to you tonight, is that it's really important if you're going to work with these large, in many cases, publicly traded corporations, that you have a very clearly defined target that you're trying to agree to when it comes to compensation. And they really are leaving that to you. There's one thing to know is your participation is certainly negotiable, and that the rates for participation and compensation will vary based on geographic regions and from practice to practice. And that's really dependent on you as a practice owner having a really good handle on the targets you're trying to hit. And as you can see, that's really understanding the balance between the market rates and your procedure costs. So developing your target fees is going to require that you've got a pretty good handle on that upper and lower range. And so we want to talk about steps first to determining your market rate, or what the market rate is. And those steps start with a market fee analysis. And that can be difficult to assess on your own. Determining how your office fees will compare to your peers, unfortunately, is restricted by antitrust provisions that don't really allow you to discuss your fees with your peers. And so getting a third party involved, like Henry Schein, or there are a number of other third parties that can provide you office evaluations of your office fees and compare them for your market. But that's really the starting point, is making sure that you evaluate where the market is and where you fall. Most of these office fee assessments are percentile based. It's important, I think, for you to know that the standard in the PPO industry is that fees will be based on a 65th percentile for a geographic area. And so knowing where you fall is going to be really important in trying to evaluate where your target fees should be set at, and again, where your actual office fees and market rate fees should be set. Secondarily, it's important to know your overall market, to understand the demographics of your area. We suggest using a 25-mile radius. That's generally considered an adequate range for travel for patients. And it's important to understand who the major employers are within that radius, what plans they're offering, understanding the makeup of the community and the types of patients you'll be seeing, the types of treatment that you can be offering. And lastly, determining a patient acquisition cost. And this is certainly more difficult and an area that, again, we'd suggest some third-party help with, a marketing company perhaps, or using some of the internet analytic tools. But what this really is determining the amount of cost that needs to be expended for you to acquire a patient. So this is understanding what you're paying to acquire a new patient via whatever marketing avenues you've chosen. Obviously, in today's market, to not be utilizing search engine optimization, and understanding that a large majority of patients are going to search out dental treatment using the internet. And what's great is there are a lot of good tools for you to determine acquisition cost. Google Analytics provides some good tools, again, to assess what the cost is for advertising and trying to acquire a patient. But that needs to be factored in because in reality, you are utilizing your participation in the PPO networks as a marketing tool. And those, as a marketing tool, they're quite expensive and you're offering large discounts. And so it's important to combine and really understand the total cost of acquiring a new patient. Next is something that a lot of practices really have not put a lot of time or thought into, which is procedure cost. And procedure cost can be difficult to compute. So we want to give you some steps to determining what your procedure cost is. But we do feel like it's extremely important, if you're going to get that target fee dialed in, is for you to have a good understanding of what your procedure costs are. And the reason for that is that as you enter into contract to participate in network, it will be done on a procedure basis, like on a per procedure cost. And so your compensation will be based on that. And so it's important for you to be able to assess whether it's valuable for you to participate in network, for you to know what your procedure costs are. And so we start with a total annual practice cost. That's pretty easy to get from your accountant, or if you do your taxes and accounting in-house. But for you to understand your total practice costs, and that includes your own, the labor and salaries of the dental providers. Even if you are the owner of the practice, your typical labor costs should be factored into the practice cost. And then a determination of what your practice capacity is, and really understanding the number of days that you're going to be open in a given year. And it's important to understand what the capacity of the practice is to offset or to recoup the annual practice costs. But an additional step is going to be to understand the frequency in which you provide various procedures. Another word for that would be your production summary. A lot of practice management software provide production summaries, but it's important for you to break down what you do and the amount of dentistry you provide by procedure. And that will allow you to get a good idea of what each procedure needs to contribute to the overall cost of the practice. And that requires an additional step, which is understanding the procedure revenue. And a good way to kind of break up the costs, or at least what we suggest to a lot of our clients, is that they use procedure revenue as a way to get an allocation of the percentage of the cost that should be offset by a particular procedure. And that will give you what that procedure is really costing your practice to deliver. And kind of lastly, in determining what your procedure cost is understanding what your participation is and mapping that out. And that's really looking at all of the contracts that you have entered into and understanding what discounts you have agreed to, and understanding what the average compensation is per procedure. Once you factor in the fact that a large percentage of your patients might be using a third-party payer or some other sort of dental benefit that they are entitled to. Once you have both the top line and the bottom line, it allows you to kind of dial in that target fee. And this comes to then assessing really where your UCR should be, where your market rate should be set. We would suggest that your UCR is at least 15% above what you've determined your target fee is, because it'll be difficult in most cases to get that target fee if your UCR fee is not substantially above, and give yourself some room to allow for discounts and participating in network with a large number of plans. What's diagrammed here is obviously a lot of different PPO fee schedules, and understanding that if you're agreeing to participate in network and under contract, that at least 50% of those contracts or 50% of the procedures that you're providing are at a compensation level above your target fee. If you're not doing that, then it's obviously going to be very difficult to hit your target. So that gets us to, once you have a good understanding of what your target fees are and you set those, I'd like to introduce you to a concept we call participation optimization. And this is understanding how the insurance and PPO markets work and what the available ways to participate are, so that you can optimize that participation. There's obviously two different ways that you can participate in network. One is direct and the other is indirect. If you're not participating, then that would put you out of network. And while you can still see patients, and patients may be able to utilize a portion of their benefits, you might find that a large number of patients are going to be resistant to seeing or accepting treatment if you're out of network. And they're going to want to see that you in some way are participating in network so that they can utilize either all or a large portion of their entitled benefit, and that they know and have a comfort level that the pricing for their dental treatment has been vetted by their plan provider. And so there are three ways that you can participate in network. The first being direct, and that's pretty straightforward in the way that I think most doctors think of how they would generally be in network. And that's through a direct contract directly with the PPO or insurance company that's providing the plan and enrolling participants and enrollees. And that is somewhat straightforward. You're going to enter into a legal contract to provide services on a per procedure basis with a preset designated compensation per procedure. And that's set out in an appendix called the fee schedule as part of the direct contract. And so I'm sure the majority of you participating tonight are in some sort of direct contracts, and that's pretty understandable. The next type of participation would be through a leasing provision between a PPO company that you have entered into a direct contract with, and then an additional company that they have in turn gone into contract with. And it's pretty standard practice in the industry now for PPO companies to lease and share doctor panels. And this will be in the case where a company might choose or unfortunately is not successful in recruiting enough doctors, and so in a specific geographic area. And so they reach out to another PPO company and pay a fee to lease their doctors. And this provides the patients the ability to see a larger number of doctors. And really that's the whole essence and attractiveness to the market of a PPO, which stands for preferred provider. If they don't have large numbers of providers for the patients to choose from, they're not really fulfilling on that value proposition that they're offering to the patients. And so many PPO companies choose to lease panels to increase the number of providers that their patients have access to. In turn, this provides an opportunity for the provider to have access to additional patients and to be treated as in network. But it is under that contract that they have agreed to with the original PPO company. Lastly, we see umbrella networks, which is the third type of participation. And umbrella networks is really just an expansion of participation type 2, the leasing network, but just expanded to a massive degree. We'll see an umbrella network company get involved where they will have, in many cases, hundreds of third-party payers that they're under contract with to provide access to the contracts that they have with various providers. And this last type of participation is what really has caused a lot of confusion in the industry for the providers and for the average dental practice, which may not understand the complexities of these networks. And it can cause a large number of companies having access to your fee schedules with, in many times, not your knowledge. But more commonly, it will also result in that you will be over-contracted, that you, with a single PPO company, might have 3 or 4 contracts in place, all at different levels of compensation. And this can make it really confusing when it comes to treatment planning and giving your patients some idea of what their dental treatment is going to cost. And more importantly, it can provide a real disadvantage to you when it comes to being compensated at a rate that you thought was fair or agreed to, because often we'll find that if you don't understand the umbrella networks correctly, you might be subject to lower compensation rates than what you thought you were eligible for under direct contracts. To give you the example here, we have 2 insurance companies. In the case of insurance company B, they are not in direct contract with the dentist. Insurance company A is in direct contract with the dentist, and as a result of that, the dentist is seeing their patients. When those 2 companies form a strategic partnership or enter into a provider panel sharing agreement, it now provides the patients enrolled in insurance company B's plan to see the dentist. And that's a great thing if the dentist is comfortable with the contract that they've entered into with insurance company A. But if the dentist entered into that contract thinking that there was a small number of patients and that all the patients that they were seeing that may be enrolled in insurance company B, that they were seeing out of network and might be being compensated at a higher rate, as a result of the partnership, the strategic partnership or panel sharing, the doctor is now obligated to provide that same level of discount to all of these additional patients. And again, this can cause a disadvantage many times to the doctor, and provide, as diagrammed here, layers and layers of contracts and fees that many might be acceptable, but many may not be. And so if you think of before optimization, we'll have the large number of patients that might be accessing a dentist through various different channels and various different contracts. Some of those contracts might be right at the target fees that the doctor set. Some might be above, which would be great. but many may be below. And what you want to do is go through, and why we talk about optimizing and mapping out how you're participating is eliminating any contracts that are overlaps, that provide multiple ways for a patient to compensate your practice at a level below what you're comfortable at. And this is very doable by understanding, again, how all of these companies interact with each other, and understanding the provisions that you have to opt out of certain programs. You may decide to see certain patients through an umbrella network as opposed to direct contract. You may decide that it's better to see patients through a direct contract and opt out of various umbrella networks, or at least provisions within those networks. It's also important to understand that some of the networks might elect to opt you out of those provisions. So while you might think that you can see patients under a certain umbrella network, you need to make sure that you verify that and clearly understand what patients you have access to and at what fees. Lastly, it's important to understand that these network arrangements will continue to change, and so they need to be reviewed really on a quarterly basis at a minimum, and make sure that you do understand how you're being paid, that you do an audit of your EOBs to make sure that you're getting paid at the rates that you're expecting. If you're not, that's the opportunity to do a bunch of research and make sure you understand why you may or may not be being compensated the right amounts for your participation, and get it worked out. And I realize in theory this is all pretty simple, quite a bit more difficult in practice. And so I think it might be helpful at this point for us to go through some real case studies. These are real life doctors out of confidentiality, and respect to their privacy. We've redacted the names a little bit, but these are real practices. We'll start with Dr. Brennan in Texas. When we reviewed their participation, we found that there were many opportunities to either go into direct contract and negotiate higher compensation rates, or to optimize their participation. And that's a little bit more complicated scenario, and so we'll dive into that a little deeper. In this case, Dr. Brennan was in network with Sun Life through a leasing provision under Aetna. And by evaluating that and going direct in network with Sun Life through direct contract, Dr. Brennan was able to increase the compensation by 16%. So a real big impact on the practice. If we project out the net profit and impact that it's going to have on his practice, it's over $23,000. So certainly this is difficult and it's very, very time consuming, but very worth it in terms of net profit increase to your practice. Let's give another example here. Dr. John in California, we look at his overall optimization schedule. It resulted in $133,000 worth of increased profit for the practice. And clearly here, this practice was very, very involved in the PPO networks. And so there was a lot of opportunities to look at how Dr. John was participating and to find suitable ways to optimize. As just a line item, you're seeing at a minimum, thousands of dollars of increased profitability. In some cases, tens of thousands. And we'll take one of the more detailed parts of his participation. But when we looked at his participation, again, through a direct contract, in this case with principal, it was more advantageous to look at a umbrella network or a repricing network under Zealous, and to switch participation with the principal network and put that under the Zealous umbrella network. In doing this, it increased the compensation by 10% for the procedures done to principal patients. And for this particular practice, that was, again, close to a $23,000 increase in net profit. And so very, very advantageous to the practice to dive in there and look at the differences between an umbrella participation and being treated as a network, as opposed to being in a direct contract with principal. I'm trying to give you some a wide variation across the country. So let's jump to the East Coast in New York, where Dr. Renee, this is probably not the normal results for doing optimization, but certainly a highly successful one at $284,000 of net increase. So extremely impactful to the practice. So again, while this is an arduous task and realizing going through and really understanding each contract that you have and looking for opportunities that you can still see those patients and be treated as in network with these plans, but maybe find the most optimal compensation rates. We believe you're going to stay within that value proposition in which patients are still willing to accept treatment and are feeling very comfortable that they're getting fair pricing for their dental treatment, and yet having a great impact on the overall profitability of the practice. And so again, let's look at a specific case of optimization as opposed to just negotiating with up the direct contract, which certainly is available. Your first step should look at all your direct contracts and share your target fees and even your cost procedure with the network, with your network contacts and with provider relations, and attempt to negotiate a higher fee. So we do with all of our clients, but there might be the case where then some optimization is going to be required. And in this case, for Dr. Renee, we looked at their in-network participation with Aetna, and that was being done under an umbrella network through Denton Max. And by looking at going direct with Aetna and entering into a direct contract, in this case, Aetna wants to have as many directly contracted providers as possible. And so as a result of that, there was a more advantageous compensation schedule available rather than participating with Aetna via an umbrella network. And so in this case, it was increased the compensation by 25%. And for this practice, it was seen, a fairly substantial number of PPO patients, as we saw, a 280,000 plus increase to their bottom line was helped by this $42,000 increase just with Aetna alone. This is where we want to give you a word of caution that optimizing participation is difficult, and you need to be very, very, very careful. You need to understand your cost side and really understand where you fit in the marketplace. So that first step of getting a market fee analysis is very important. It's also important to remember that if you are going to optimize by participating through leasing agreements or umbrella networks, that those arrangements change. They're not, locked in. They usually have certain time provisions. The direct payers, the third-party payers, sometimes will reclassify providers within the network if they are participating in an indirect fashion through an umbrella network or leasing provision. And that might allow the payer to change the compensation rates or reduce the amount of benefits that a patient or enrollee can apply to their dental care. And so you want to be reviewing your optimization regularly. When I say regularly, every three months is worth doing some sort of EOB audit and reviewing your compensation schedules. But we realize it is complicated. We will open up here for some questions at this point. But we'd also like to offer a free consultation for any doctors that have questions. We realize we went through a lot of things fairly quickly tonight, going through this presentation. And so we'd be more than happy. We provided a link on the screen if you want to go and have a one-on-one consultation. We'd be happy to do that completely free of charge and complimentary care of Henry Schein. So that I'll take any questions, Adam, that we might have.
Great. Sounds good. Thank you. Great presentation. We do have some questions and we've got quite a bit of time left for live Q&A. So if you have any questions, feel free to add them to the Q&A and we'll get to as many as we can. First question is, why do PPO insurances pay more for a procedure when the provider is out of network?
Well, they're not necessarily paying more per procedure for being out of network. What they're doing is that they're allowing, if you're out of network, you're not in contract. And so the fee that you're able to charge is whatever your office fee is. Then that may be reduced by a percentage because you're out of network. And then the percentage of benefits that the patient is able to apply may be reduced. So in that case, if a patient is willing to see you out of network, you are able to receive a higher compensation rate. And that's because you haven't agreed in contract to taking any kinds of discount. But what many find is that the patients are reluctant to see doctors out of network. If you're fortunate where you've built a relationship and rapport with patients where they feel more comfortable working with you even though you're not in network, then that's a great thing. And that really is why it's very important to scrutinize when you enter into umbrella networks, because you may inadvertently start to see patients in network that you were already seeing out of network and receiving your regular market rate compensation. And so that's why it's tricky when you're evaluating participation to make sure that as you enter into these contracts that have these leasing provisions, that again, you don't inadvertently put patients that you were seeing out of network and put them into network and therefore have to offer them the discount. But great question. That's the reason why, is because really the out of network benefit varies from plan to plan, and the actual compensation is set by you because you didn't enter into an in-network contract.
How do we find out if it's better to be contracted under an umbrella contract for a company versus directly contracted when they won't provide us fee schedules ahead of time?
Well, I would say that you should be demanding fee schedules ahead of time. That if they won't provide them, then I don't know that they're really interested in having you go in network, because the fee schedules are part of the in-network contract. I would be the first one to tell you, since we do it for hundreds and hundreds of clients across the country, it is difficult to get all the fee schedules and to be able to evaluate them against each other. That's one of the advantages we have, representing a lot of clients and being in over 40 states, and actively representing clients, that we have more access. But for you, if you're really seriously considering going in network, either with the umbrella or indirect, you have to see the fee schedules. They are always part of the in-network contract. It's important to understand that the credentialing portion of that contract is the signature pages. So that if you're getting into the credentialing portion, then that means you're agreeing to the fee schedules. And you're right, sometimes they're not provided. It's up to you to ask for those fee schedules and to collect them. But there's never a time that you are obligated to go into network without having a contracted fee schedule that you get to review and think about before you enter into in network.
How do you determine if optimization or direct contract is more advantageous?
Well, that's the reason why, as part of the strategy session, we talked about understanding the market rates, your cost of procedure, and then having your target that you set. And then as you lay out all of the different avenues you may have and evaluate how you're going to be treated as a provider through the umbrella networks versus direct contract, because they will, occasionally they'll vary. Some umbrella network providers are treated the same as direct contracted providers by PPOs. In some cases, some of the companies have elected to treat their direct contracted providers with some different provisions that they don't offer umbrella network providers. So you have to really map them all out and then do an evaluation based on, one, the overall compensation. That's the easiest way, but like that first question, you have to evaluate what kind of exposure an umbrella network might provide when it comes to seeing existing patients that might have benefits, but that you're not in network with. And as a result of going into the umbrella network, you've now become in network. And so really, you just got to do a spreadsheet and sort of look at, that's why we talk about that procedure frequency breakdown and really understand where the numbers add up. And it may not be very advantageous for you to see patients outside of a direct contract through an umbrella network. And many times it can be. One of the advantages of the umbrella networks is that you're only having to credential and enter into a single contract, and that gives you access to a large number of networks and therefore a large number of patients. The problem is that it does provide for a large amount of complexity and work on your part. But that was one of the reasons why we showed the actual case studies, that in many cases, it's extremely financially advantageous for you to look in and really make decisions and optimize and pick ways to still be in network with patients, but maybe not in the most obvious ways, which could be the umbrella network, which is going to put you in network with hundreds of plans, or breaking it all out and figuring out the very best direct plans, or maybe even just a very unique leasing partnership between two PPOs that you have a lot of patients in.
All right, let's see. Can you negotiate your fees at any time or only before your contract expires and you sign a new one?
Well, obviously, the PPO companies are resistant to wanting to negotiate at all. In fact, the first couple of times that you get involved with them, the standard practice is probably to say that they don't negotiate. I can tell you from working with hundreds of them and representing hundreds and hundreds of clients that the contracts are negotiable. And when it comes to the timing for negotiating those contracts, really it's up to you. And you know, I always use an analogy of when my daughter tried to negotiate her curfew. I told her she wasn't eligible for increase to her curfew for 2 years, but she didn't agree to that and settle for it. She just kept asking and asking and asking. And not to say that it's as simple as just being tenacious and just keeping at it, but that really is a big part of negotiating your fees, is not being willing to take no for an answer. Generally, if you have received an increase or you have just entered into the network and just agreed to participate, it's going to be difficult for you to negotiate within a 6-month, window or time frame of just having an increase or have just entering into the network. But really, you should be the determiner of when you negotiate that fee. If it doesn't work, I mean, we've just gone through a very difficult time for our country, and something with COVID-19 that's going to greatly increase the cost of providing these procedures. And so we've encouraged all of our clients and encourage and do these webinars to encourage every dental provider to really look at their costs and really understand the cost of providing these procedures. And now is a critical time to look at those costs and understand that there might be many fee schedules that you're in contract with that are not meeting the burden of the cost. And so those are when you need to jump in and negotiate them and use the leverage of understanding the various ways to participate to negotiate higher fees. Why we shared this strategy with you tonight is to open everybody's eyes to the fact that there are lots of ways to participate in network around direct contracts, or in many cases, a lot of doctors are just participating in umbrella networks and they have never thought to reach out and go direct to a lot of the payers and see what kind of contracts are available for direct contracting in network. And so I don't think there's ever any hard and fast time that you can't negotiate. Again, I think the industry standard is that they would like to not be negotiating more than every couple of years, but circumstances just might not allow for that. And it's really the provider's responsibility, since you're the one providing the care and looking out for your patients, to make sure that the fee compensation is reasonable and to be setting what the market rate is and having that adjust as costs increase.
If you are contracted with Principal, will you show up on their shared network directories as well?
You know, those types of questions I'm going to throw to having you do in a consultation. Again, we're more than happy to provide a complimentary consultation to really look at your unique practice. And so if you're willing to do that, we'll make that time valuable. But to just answer questions like in a wide range of what companies you could see, again, because it does change and because it's unique, sometimes geographically, you might find that the standard practice is that all of the providers that are available to a patient should be listed in the directories and show up in any listing of the providers. But again, there are certain situations and provisions that for non-direct in-network providers that may preclude them from being listed in certain directories or showing up there. So again, I don't want to evade your question, but I want to give you an accurate answer, and that best way to do that is to understand your very specific situation, which we're more than happy to do like one-on-one in a consultation. So I'm going to kind of punt on that question rather than throw out. I don't want to have any liability for giving you the wrong information in a group forum like this. But I'd be happy to talk to you again directly in a consultation.
How often should you negotiate contracted fees?
Well, because there's not set timing on them, I think you have to be actively engaged and constantly looking at your participation and negotiating. Again, I think it goes back to the earlier question. You shouldn't expect increases any more often than on an annual basis. Again, certain situations might require increases or a change in how you contract. You might want to look at additional opportunities by going indirect or switching to direct. But I think a good rule of thumb is annually there should be conversations about fees because your costs are going to change annually. We've really seen a lot of, again, turmoil kind of in our marketplace as a result of COVID-19. But earlier before that, there can be changes in the labor markets in various geographic locations, or changes in, the real estate market that make rents increase. I think that the best practices should be that any practice owner should be evaluating their fees at a minimum on an annual basis and really looking at are they suitable to meet their targets and goals.
If you are in many networks and an umbrella pays more than the direct contract, is it easy to get out of that direct contract and stay in the umbrella contract?
You know, it's not easy. It's not impossible. And it's not even, I would say, overly difficult. It just takes a lot of research on your part to make sure you understand all of the implications of changing your participation status. It requires you not just understanding it from the direct contract side of that third party payer, but understanding the umbrella network and what changes it might go through. And so it's not easy, but certainly doable, and a key to really optimizing. So again, it goes to doing the homework and doing the research. Again, this is something that we would throw out to you is going to take hours and hours and hours of time. But that's really the reason why I showed you the case studies. I mean, the case studies aren't valuable to you as a whole, except for you to demonstrate what can be done and what the return on investment can be. And so it is hard and difficult to do this, but it's worth the time and effort because it can have a dramatic impact on your overall profitability. But it's not overly difficult, but can be complex and is part of the optimization process.
How do you determine if an insurance company participates in an umbrella?
Well, the first way is to contact the umbrella network and just get a list of their partnerships and who they're representing. Another way to go about it, and that is somewhat straightforward, but there'll still be a lot of holes. Another way to see what opportunities might be available through umbrellas is by actually using the EOB and researching and seeing who actually paid the claim. And by using the EOB, you are, for those that aren't familiar with participating network, that's an explanation of benefits. But that the EOB will state how the claim was paid and through what partnerships or umbrella networks may exist. And then thirdly is to talk to provider relations, and they can, in many cases, explain. I won't say 100%. They'll always know all of the companies that they are providing in-network services to, but they certainly can give you some very good ideas. And that's why we kind of use the term mapping participation, because it is like drawing a map. You've got to kind of figure and understand who's participating with who, and all the different avenues. And again, you know, we're at probably a little bit of an advantage. It's easy for me to say do that when we're doing it for, you know, hundreds of locations. But certainly with a little bit of research, using your provider relations department for each individual company, you can kind of draw a map of how everybody is working together and participating with one another, and therefore how you're being treated and what your status in network is.
Great. We've got about 7 minutes left and plenty of questions to answer. So we will not be able to answer everyone's questions, but per Scott's suggestion before, I do recommend you go to pposolutions.com, and he and the Unitas Dental team will be happy to take care of you there. Do some networks not allow you to go with an umbrella?
Not that we've come across. There are some companies that don't participate in umbrellas. They're very limited, but Delta Dental is the one that stands out. Generally, they do not participate in umbrella networks. So if you're trying to access Delta Dental patients, most of the umbrella networks, that's not going to be an option. Occasionally, just like use Delta Dental as an example, there may be provisions within their contracts that require you to offer them the same compensation rates that you've agreed to in an umbrella network, or that you are agreeing to in your in-house plan. But generally, there's not a restriction on your ability to participate. There is one type of network which is called an EPO, which is an exclusive provider network. And in those cases, those contracts occasionally will have provisions because you are an exclusive doctor. Those are a little bit more like DHMO type plans in which you are going to be assigned a specific number of patients, or because in the case of like an EPO, there are a very limited number of providers. You may not be able to participate in both an EPO and an umbrella network, but generally there's not a lot of restrictions on your ability to participate with umbrella networks. But again, it's always taking the time to really read your contracts and understand what you're agreeing to, and understanding what the compensation levels are, what the ability for the company is to lease your fee schedule out, so that you really can understand what your exposure level might be in your marketplace if you are seeing large numbers of patients out of network. So it's kind of focusing in on the details of the contracts.
Can new associate doctors share the office's existing PPO plan, or do they have to have their own PPO contracts?
They need to be credentialed and enter into the contract. In some cases, they may have their own fee schedule and contract. In some cases, they may utilize the already predefined fee schedule that's with the existing doctors in the practice. But that is another area that you have to be very, very careful with. Anytime you're bringing in associate dentists or bringing on new partners or new providers, if providers are treating patients even in your practice and they're not an associate, they might be coming in and just doing might be a specialist that's doing procedures in your practice. It's important for you to, again, understand the contracts and what the provision is of your contract. Some contracts are going to require that any providers that are doing procedures in your practice, that they fall and agree to the fee schedules that are assigned to that practice. That can certainly be negotiated, and that provision not put into the contract. But it's important to understand that you're compliant, that any provider that's doing procedures in the practice, that they have clearly defined their participation with the PPO, so that patients that are coming into the practice are not seen by an out-of-network doctor when they are been told that the doctors are in network or that the practice is in network. And so again, those are complicated arrangements. That's again another one where if you have specific questions about how associates should be treated, that's a good one to maybe have a consultation with us so we can understand the very specifics of your area and the different PPO plans that you're in network with. It will vary based on company how associates are treated.
Great. Well, that's all the time we have tonight. So thank you, Scott, for your presentation, and thanks everyone for joining us. If we were unable to answer your question, please go to pposolutions.com and request a complimentary consultation. Scott and his team will be happy to assist you. Everyone in attendance tonight will receive a link of today's recording in the coming week via email. On behalf of Henry Schein Dental Business Institute, thanks for joining us tonight, and have a great night.